You're listening to the Yoga Medicine Podcast. I'm your host, Rachel Land. This podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts Tiffany Cruikshank and Katya Bach as we dive into all things yoga, research, and wellness.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.
Well, hello. Thank you so much for taking time out of your busy schedule to join the Yoga Medicine Podcast.
Thank you, Rachel, for having me. I'm a big fan of the podcast.
Oh, yay. That's lovely to hear. Oh, awesome. Well, we are here today to talk about breast cancer, which is something I suspect that a lot of people don't want to talk about until they need to. So hopefully we'll be able to get some information out there that will help people and not scare them too much, which is, I guess, always a delicate balance when it comes to the C word.
I agree. And I also think in regards to breast cancer, I think there's a lot of fear in general around it. And especially with October being Breast Cancer Month and pink everywhere, I think even if it's not on the front of your mind, it's on the back of your mind somewhere.
Yeah, I agree. So what prevalence does breast cancer have, including for men? Because I presume it can affect men as well as people who are influenced by female hormones.
Sure. Well, let's start with the men. So really, breast cancer in men is rare, and the incidence is about less than 1%, about 1,500 cases a year are diagnosed in the United States related to breast cancer. That may be rising a little bit, and I hope we can kind of get into that more when we talk about nutrition. With women around the world, breast cancer incidence is about 1 out of 8. Now, there are some countries that have a lower incidence, and like Japan and some areas in Africa, but really in industrialized worlds, the incidence is about 1 in 8. The average age is 61.
Oh, wow.
And 61. And perhaps that's because about 25% of women who are diagnosed are under the age of 50. So they're in that reproductive period, that perimenopausal time too.
And how do we understand our individual level of risk? I think there's a thought that it all comes down to genetics. And if we don't have it in our family, then I don't even have to think about it. Don't even have to worry about it. But I guess that's probably not true.
This is such an important question. So the average risk, if you're 30 years old or younger, is actually like less than 3,000. However, if there is a family history, that risk may be increased. And if you have a relative that has had breast cancer, you should really start screening from 10 years before their diagnosis. So if you had an aunt who was 35, you should probably see or to your gynecologist even as early as 25. They may not get imaging, but at least have that discussion around your risk. As it relates to genes, believe it or not, breast cancers are related to an autosomal dominant gene pattern, okay? So that means that you can get it from your mom or your dad's side. And the incidence of inheriting a gene is only about 8 to 10%
of diagnoses.
And everyone has heard about BRCA. Yes, it's only 8 to 10%. So 8 to 10% of women who have breast cancer will have a gene. Everyone has heard about the BRCA genes, but really we have extended panels now. And there can be just under 90 different genes that you can be tested for that may increase your risk for breast cancer and other cancers. So we call it now panel testing. The thing around BRCA genes that I think is interesting and perhaps not understood, there are over 500 different BRCA genes, meaning the common types are BRCA1 and BRCA2, but within BRCA1, there's a certain number of BRCA1 genes. Within BRCA2, there's a certain number. There's also another gene called CDK2. I'm sorry, PALB2. CDK2 is another one, PALB2, that actually mimics like BRCA2. So when someone is diagnosed with breast cancer and they qualify for genetic testing, they're actually tested for many of these genes.
That's definitely not I think the public story that we're hearing. It's sort of you've got the gene, the BRCA gene, or you haven't. And if you haven't, you're probably good. And if you have, you're probably not good. And the real story sounds a lot more, what a surprise, a lot more complex and a lot more nuanced than that.
Yes. And when you look at really what causes breast cancer, I practice allopathic medicine, right? I'm an MD. We treat disease. We haven't done a great job to figure out what causes diseases, right? But what causes breast cancer, we know that yes, about 8 to 10% are a gene that's inherited, but it's not only that hit. So you have to have some other risk or been exposed to a carcinogen. Let's use smoking, right? You have to be exposed to a carcinogen. So the body has a way of trying to heal itself. So yes, you have the gene, you might have a lifetime risk, about 87% chance if you have a BRCA1 that you might get breast cancer in a lifetime. But there are some people that never develop breast cancer.
So let's shift gears then to talk about the prevention side. So you've suggested on that assessing our risk side that if you do have family history of it, it just means you might start the screening process a little earlier than the rest of us, but we all kind of wind up in the same basket at some point in our lives. So what can we be doing to prevent, or at least to reduce our chance of introducing one of those extra extenuating factors? I'm guessing quitting smoking is step one.
Since you mentioned that. You're right. So, there are things in families where there is a gene that they've been testing. There's no exact gene that they could put their finger on, but the family looks like they might have a breast cancer gene. So let's tease it out first. So I wish we could understand fully what the risk is. And I think the more we learn about the microbiome, the more we learn about things in our environment that cause changes within the body to increase your risk for cancer, so inflammation, the more will be revealed as far as why there's certain risks in families. So other things, you think about epigenetics, so outside of the things that you inherit, and most of it is our lifestyle. So cigarette smoking is a risk factor for breast cancer. And if you are a smoker and you're diagnosed, you also have a higher chance of recurrence. There's also something interesting that happens with smokers too, because of the vasoconstrictive effects of cigarette smoking. They tend to have more infections with surgery, or if they need a mastectomy and choose to have reconstruction, sometimes there are more complications. So we try to enroll our patients who are smokers into stop smoking programs to try to help them with their healing. Probably the most influential things that you can do to prevent breast cancer is to look at your diet. So processed foods, all of these additives and all of these ways that they manipulate our foods to make them taste yummy for us, and buy more Doritos and all those other things, right? It's so engaging. They're really not good for us. They're chemicals that we shouldn't be having in our body, and they do disrupt the microbiome. There has been some research to show that if you have taken a lot of antibiotics in childhood, and this goes back to the microbiome, that you may increase your risk for breast cancer as you get older. So that's interesting. Eating a Mediterranean diet, right? mostly focusing on fruits and vegetables, eating a Japanese type of diet where they add, products from the sea and really focus on fruits and vegetables and beans. The fiber component in food is extremely helpful. If I could kind of go down this path a little.
Sure.
So, yeah, most breast cancers are hormone positive. Okay. So if you're someone who chooses to eat a lot of cheese or drink a lot of dairy, within that are estrogens, because remember, it's pregnant cows that produce milk. And normally cows should have a milk production cycle of maybe once a year or a couple times a year. But we keep our cows pregnant all the time. So we give them hormones. We give them antibiotics. We perhaps don't feed them grass. They have soy or corn. And that changes how that milk is made of. And it actually might cause more inflammation in the body. So if you're someone who likes cheese, to reduce your risk for a hormone-positive breast cancer, pair that cheese with fiber. Because when we eat fiber, we carry out the extra hormones through our waste.
Okay. So hormone positive means that the more hormones we have, the more likely we are to develop the cancer. Is that what hormone positive means?
So hormone positive means within breast cancer, there are many different subtypes. And about 70% are estrogen positive or progesterone and estrogen positive. So that's what I mean by that. They're the most common type of breast cancer. And as we age, that tends to be the cancer that develops in women as they get older, breast cancer, hormone positive cancer. It can also happen to young women, but it is thought that perhaps having extra estrogen in the body, as you were saying, may increase that risk for breast cancer. So women that never had a child, because their ovarian cycles have never been interrupted, like because when you're pregnant, you disrupt that cycle, they seem to be at higher risk.
Okay, don't scare me too much because I like cheese and I've never had children. So, I'm going to increase my fiber intake here to help. So plant-based, lots of fiber, avoiding processed foods as much as we can, healthy fats, food from the sea. All of this sounds like the kind of a dietary advice that most people agree on, even people who are vegan and vegetarian versus people who are pro-meat. There's still a lot of room in the middle for us to eat
Absolutely
less processed.
Absolutely. I mean, most of us should be eating a Mediterranean type of diet. So that's a lot of nuts, a lot of berries, good vegetables, a lot of polyphenols. So you could really reduce your risk of breast cancer by having 3 cups of green tea a day, having reishi mushrooms and shiitake. You want to cook those. So there are many things that we can do that are beneficial. Now, Rachel, one of the things that probably appeals to you the most is when people exercise, okay, especially teenage girls. Yeah, there you go. When we exercise, we actually help stabilize estrogen levels within our body. We also help stabilize, our insulin output, which can increase inflammation in the body if we have too much like sugary things. It's really good for the body, and it can help decrease the risk of breast cancer. And when you look at women that have had breast cancer, probably moving your body and exercise is one of the most important things that you can do.
And I wonder, is there a difference between movement-based, cardiovascular-based exercise and strength-based exercise? Does one seem to help more than the other?
So there is some really recent information that I think is so exciting. And this started coming out around 2018, maybe a little bit before. So whether you do aerobic exercise, whether you do yoga or Tai Chi, whether you do weightlifting, there's something about engaging your skeletal muscles that creates changes within the body called myokines. So the skeletal muscle themselves actually put out these little proteins and peptides to go through the body, and they have many functions. So they improve your immune system.
Mm-hmm.
They increase the number of natural killer cells that go target breast cancer cells and other cancer cells. The other thing that they do is they go through the microenvironment to come around cancer tumor cells. They see them as invaders. They're like these little soldiers when you move your body, and they go attack cancer cells, and they could cause apoptosis, which is the death of a cancer cell.
Mm-hmm.
This blows my mind
Mm-hmm.
that skeletal muscle itself, and it's any type of movement, can go and inhibit metastatic disease. It can help prevent cancer from occurring. It's fascinating to me.
I mean, that you had me at hello. That all sounds wonderful to me, and it reinforces my feeling that when we're in our body, when we're challenging our body in varied ways, it responds by getting stronger and more capable and more resilient. And I can see lots of tie-ins to yoga practice there with all kinds of asana practice. But you also mentioned inflammation, and that always makes me think about the role of the central nervous system. And I know there are some ways that yoga can help there too. So what are some of the ways that you can see yoga reducing our risk of cancer outside of just asana when it comes to pranayama, meditation, resilience to stress?
Sure. So I'm kind of polyvagal junkie. I don't know if you know the polyvagal theory by Stephen Porges. So I really am into understanding our autonomic nervous system. And when you look at, kind of tapping into the parasympathetic system and the sympathetic system, this is where a yoga really makes a run, right? So through yoga, through breathing, we can engage not only in movement and stretching, which is so important for healing. Because if you think about, me as a breast surgeon, I remove tissue. And when I remove tissue down to the fascia and under the skin. So, that superficial fascia that's under the skin gets disrupted, and then that fascia on the chest wall. So because that has caused a void there, now there's some restriction in possibly move. So yoga helps the body remember how to move and how to act in a coordinated way. But getting back to the polyvagal aspects to yoga, when we're in yoga, that's one of the best tonics for our vagus nerve. And our vagus nerve has many functions. The dorsal vagus really is kind of below the level of the heart, and that helps our afferent, kind of telling our body afferently to the brain how healthy we are. It's our parasympathetic rest and digest. Rachel, chime in anytime you want to join me. So by engaging that parasympathetic system, we can really impact the inflammation in our body. So through our breathing, through asana practice, through meditation, it's key. I'm going down a little rabbit hole. Also, when we breathe in yoga practice, it helps our lymphatics flow. Okay.
So that
pumping action from the lung helps. So really, when we are working, especially with cancer survivors, to kind of reduce the risk of lymphedema and engage, we should begin with breath work and end with breath work. Okay. To kind of get that lymphatic flowing. So the sympathetic system is kind of our fight or flight. And often I feel cancer survivors kind of live in that mode, right? So whether they're going through treatment, they're going from one doctor to another doctor, they may need chemotherapy, and then they know after chemotherapy, they may need surgery, and then after surgery, they need radiation. So they're always on this heightened sense. So by doing yoga, it helps them bring them back to their home, right? Um, so when you look at our autonomic nervous system, whether we talk about cancer, whether we talk about heart disease, whether we talk about autoimmune disease, risk of stroke, having good vagal tone, right? Having a good heart rate variability really impacts the way you're going to survive. So, or if you survive. And it's really one of the best signs of longevity. And yoga is something that really enhances our heart rate variability. And there are tons of evidence-based studies looking at this.
I think you've pulled out a couple of things there that I definitely want to explore. I'd love to talk a little about lymphedema later, because I know that's a big challenge for people who've been through breast cancer that doesn't seem to get the same attention. But just circling back, you've started talking a little bit about how yoga can help during the treatment process, and that's where I'd like to head next. But just to sort of finish off the discussion on prevention, you talked about giving up smoking as probably being the easiest first step, not to do, but at least the easiest box to tick. And then dietary changes, we can all, I think, agree on some region in the middle that focuses a lot on whole plant-based foods, healthy fats, nuts and seeds, food from the sea, and the importance of screening. And then you talked about epigenetics, that genetics aren't the only influence on cancer, that there's lots of room in the middle for those genes to be emphasized or de-emphasized. And that's where that vagal tone can really come in, that instead of us always being in this heightened state, we have the capacity to come back home, to come back to a more arrested, more natural state. And I think that's really important in prevention. But as you said, it's probably even more important during treatment, because I imagine, as well as being physically and physiologically really challenging, the treatment process can be mentally really scary. So let's shift gears a little to talk about how yoga can help during cancer treatment.
Sure. There are a few other things, though I don't want to be remiss and leave out. Sleep is huge. Okay. Sleep is huge as it relates to our immune system. Making sure that you don't drink alcohol every single day and not have more than 7 drinks a week. And then that sense of community, kind of rounding back to yoga. So it is really important to not feel like you're alone going through something like this, and have a sense of community. One of the things that we do where I work is we have a multidisciplinary team. So right from the beginning, at the time of your diagnosis, you actually meet your entire team that day. And I hope that fosters a sense of community in the patients that I see. But also, I think yoga can do that. Like, yoga is this amazing net that can really help people going through treatment so that they don't feel alone. And then one other thing, there is some really emerging research coming out that they're looking at heart rate variability before a patient is really taken to surgery. And this has been done in gastric cancer and in colon cancer, some in breast. And what they found is patients that have the lowest heart rate variability, so the lowest vagal tone, actually have a higher incidence of nodal disease. So I know, right? So I think in the future, yoga is even going to be more imperative, as the studies show, because I think it's probably the simplest way to engage heart rate variability. And the things that we just talked about, sense of community, sleep, nutrition, daily movement, all relate to our heart rate variability too.
That's great. And that sort of bridges the gap between prevention and treatment, because it's something that ideally we're working on before we're diagnosed. But even after diagnosis and before treatment begins, there's a window there for us to try to work on that heart rate variability to maximize the chance of positive outcomes and minimize the chance of negative ones. That's pretty powerful stuff.
It is powerful. And you know what? It connects mind body, right?
Mm-hmm.
It's that mind body aspect. So that's exciting to me too. So
when we're going through cancer treatment, I presume the asana side of practice, the movement side of practice, probably needs to change a little bit. I'm guessing there are some points where it feels better to move than others. So what would your advice be on asana during cancer treatment?
So I think asana should be a daily practice through cancer treatment.
Mm-hmm.
And if you're not feeling well, you can do chair yoga.
Mm-hmm.
Studies show that through all types of cancer, exercise 30 minutes a day is really recommended. So one of the things that happens with cancer treatment is you start to lose some of your muscle mass.
Mm-hmm.
Okay. And particularly to breast cancer, women tend to gain weight. And part of that are the medications we give. We give steroids, which change appetite, but they tend to gain weight. And if you are more physically active during treatment, you have less neuropathy, right? You're less likely to gain weight. You feel the strength of your body, but you also don't lose as much muscle mass. So sarcopenia is when we lose muscle, and it's like you get that marbling that you go to the grocery store, you see that great piece of beef, and you see that nice fatty tissue, you know it's going to be a savory piece. You want to avoid that in yourself, right? So by
not be
being physically active, yeah, you don't want to be savory. So you want to keep active and you want to keep moving. And it helps also with chemotherapy. You know, just think you're taking a medication that is targeting cancer cells, but it also goes through your body. So the more you can move the body, probably the less likely it'll settle at your fingertips. So, yeah.
I love that advice. So you might leave out the arm balances today, but do what you can, move what you can, even if that means sitting in a chair and rolling your head or moving your arms or lifting your legs. Do what you can when it comes to movement.
Absolutely. And you can always continue your breathing practice. Like, you know, and that would be wonderful because, you know, when you engage the diaphragm and the lungs, it reduces your risk of infection. And when patients get treatment, whether it be radiation or surgery or chemotherapy, they're at risk for lung changes. So it's really important to keep up with practice if you can.
Great. I love that. Diaphragmatic breathing, get that pump going for your lymphatics. And then I'm visualizing all of those little tiny soldiers in the body fighting off the tumors. Do you use themes like that when it comes to meditation or visualization to get that mind-body connection?
So absolutely. And, you know, it has to resonate with the person.
Yeah,
so
sure.
someone may like thinking about these little soldiers, or they might, you know, maybe they're a soccer player and it's, you know, they're going out as a team. Yeah. So it's whatever works for them. You know, I try to help my patients reframe thinking around treatment because many patients will say, oh, it's a poison. It's really, it's targeting the cancer cells, right? And there are some side effects, but there are ways that most of those side effects are mitigated now. So I think that that's a huge thing. It's also exciting for me as a breast surgeon is to look at all of the changes that have been made in breast cancer treatment since the 1990s if you have a stage 1 breast cancer, the survival rate is about 98%.
That's crazy. That's fantastic.
Yes. And when you look at, the time between 1989, 2015, they had a huge meta-analysis looking at all the research, and survival has improved 39%.
That's fantastic.
I love it. So I do believe that there are great advances being made in breast cancer. And some of the studies have also shown, getting back to yoga, that when you do yoga during chemotherapy, you actually have a better outcome.
Mm-hmm.
And when we move our body and exercise during chemotherapy, we decrease the risk of sarcopenia.
Mm-hmm. That muscle loss.
That muscle loss, that muscle loss may increase your risk of lymphedema, which is a complication of swelling. It also decreases the risk of metastatic disease down the line.
Amazing. And I imagine too, just psychologically, it's going to make you feel stronger. It's going to make you feel more capable. And it gives you the sense that there is something positive you can do. You're not just a passive participant in the medical system. There are things that you can be doing every day, whether that is moving whatever you can move to maintain strength and your muscle mass and to get circulation going, breathing to channel that central pump to get your lymphatic system as supported as possible, and then harnessing that mind-body connection, whatever visualization works for you to make the process one that feels positive and constructive, as opposed to telling yourself that you're being poisoned. And then I assume that community side of it's crucial, the feeling of not being in it alone, but having a team of people around you, whether they're your medical team, your family and friends, people who are also going through treatment, that sense of you being in it together. Is there anything else that you would add to that, the
No.
suggestions for the treatment?
No, I love that, Rachel. And not only that, anything that I can do to foster a sense of agency,
Yes.
I think is beneficial, right?
Yeah. I think that's true for any illness, injury. The feeling of us having something positive we can do, the impact of that really can't be measured, I think.
I agree.
Well, I wanted to ask you about radiation in particular, because I know that can be a real challenge in terms of limiting people's mobility around their chest and shoulder afterwards. Do you have any specific advice for things that people can do during or after radiation therapy?
Well, I absolutely recommend movement and exercise during radiation therapy.
Mm-hmm.
You have less of the side effects, less of the tissue limitation. And when women go for breast cancer radiation, they're positioned with their arm way above, right? So they have to lay on a table with their arm way above their head. And they have pillows to support it and cushions, but increasing that flexibility will also make that 10 minutes of radiation more comfortable too, right? So thinking about radiation, the initial changes are changes to the skin. Sometimes there's redness, sometimes the skin peels. Sometimes you could see like the hair follicles and the nipple might change a different color. And it's important to keep that fluid moving because it's from fluid. Just think, when you get an injury, our white blood cells go to the area to kind of help and fluid goes in. It's just natural. So if you can do any type of yoga practice, I also teach them some stretches to do against like a wall.
Yeah.
Some simple stretches to use the arm against a wall. That might be helpful. It takes about 2 years to see how radiation's going to end up on your skin.
Yeah.
And it could shrink the breast. So when it shrinks the breast, you think about what happens to that fascia underneath. So if you continue to move your body and stretch, perhaps you'll have less shrinkage, less, you have
Less
better
contraction.
cosmetic outcome.
Yeah, that makes sense.
Less contraction.
And I imagine that even once treatment is complete and it's had the best possible outcome and they're cancer free and ready to continue with their lives, I imagine that for survivors, there might still be the potential for fear of cancer recurring. And I know you wrote a piece for Yoga Medicine that I can share in the show notes, that there could be this fear of it coming back. What role can yoga play in helping people manage that fear?
Well, I think it's tapping back into that sense of agency,
Mm-hmm.
right? Um, getting them to feel powerful in their body and know that they're doing something healing, and to discuss all of those other measures that, if they can choose to adapt, impacts survival. They did significant studies, observational, which means they didn't do randomized control trials, but they looked at breast cancer survivors who moved their body, and watched, ate nutritiously, and it decreased the risk of breast cancer recurrence over 50%.
Mm.
So that's huge. That's the benefit that most people get from chemo. So
Wow.
adapting your lifestyle, incorporating yoga, right? And then I'm hoping, as things evolve, as we learn more about heart rate variability, like perhaps doing yoga to improve your heart rate variability. Like if it's an opportunity for you to do anything to help improve your outcomes, it's
Why not?
able to engage.
Yeah. So movement,
Yes.
daily movement, varied movement, breathing to keep that central pump going, that nutritious plant-based diet, being aware perhaps of those hormonal influences, and then any practices that we can do to increase our heart rate variability and our vagal tone to make us a little more resilient to the inevitable stresses of life. And I think all of these things would be familiar to listeners. I think they've come up in many of our podcasts already, including sleep, which you mentioned before too, the importance of getting the best sleep that we can.
In America, we have what's called the NCCN guidelines, and these are guidelines that are put out by the national body to really give recommendations and treatments around cancer care. So they have a whole 200-page guideline set as it relates to survivorship. And when you look at survivorship, the things that really impact outcome and the things that we need to address are cognitive function, cardiovascular health, nutrition, movement, sexual function, community, reducing the risk of lymphedema, sleep. Okay. These have all been evidence-based, proven to help reduce the risk of cancer recurrence or developing another cancer. For all of those things that I just listed, yoga is one of the recommendations for each of them.
Mm.
And I think it's wonderful because it's not a drug. It's something that everybody can do to their own best, way possible. And it's exciting to me.
And that I think gives us some really clear takeaways from cancer survivors of the things that we can all do to regain that sense of agency, to have some sense of personal power over our outcomes. And none of it's new information. I don't think any of that would come as a surprise to people listening to this podcast. I think we all know how important and how beneficial movement is, and good social ties, and a good diet, and good sleep. And, these are all really big themes that have come out in the podcast before.
Absolutely. But it's fun that we now have evidence to show that it is really beneficial, right?
Absolutely. So I wanted to talk a little about lymphedema because it is, I think, an aspect of breast cancer that people just don't seem to be as prepared for, and as a teacher, certainly not as prepared for as some of the other things that people experience during treatment that are a bit more familiar, like feeling sick or having challenges with their balance. And you're involved in the brand new yoga medicine lymphatics training, and I think one of the topics that you touch on in that course is lymphedema. Is that right?
That's right. Yes. I'm
So what do
excited
we
to
need to
work.
know? What is it? What can you tell us about lymphedema that would make it interesting?
Sure. So, really, lymphedema can happen with breast cancer, but it can also happen with other cancers, especially, say, pelvic cancer, right?
Mm.
So, you can get lower extremity or upper extremity lymphedema. You can also get lymphedema of the breast. So, why I think it's so important to share this through a yoga community is because when clients come, you may notice, or they may share with you that they've had cancer treatment. And there are some certain takeaways that I think are important. And the first one is, and I believe Tiffany will go into this, is how important it is to do breathing in the beginning of class. And then to also be aware that lymphedema occurs just under the skin. So by using the muscles in the body, getting that pumping action, it can help draw that fluid within the body so it can get processed.
So
When someone is
lymphedema
doing
is when
yoga,
there's an accumulation of fluid, and
yes,
often in breast cancer, we'll see it in the arm. And then you're saying in pelvic cancer, you might see it or experience it in the lower limbs, in the
legs,
legs.
yes,
Hmm.
and you can see it in the hands. Some patients may not, or some clients may not even know that they have it. So, it's good to have some powers of observation
Mm.
in your
And what are we
clients.
keeping an eye out for? Like sort of swollen fingers, swollen toes, that sort of look.
Yeah, or when you look at, you have them kiss their knuckles so that you could see them, not that, and you can tell if something's swollen. There's also, like, you cannot, there's a swelling in other areas of the hand where normally there isn't fluid, right?
Hmm.
And you may just notice a difference in the extremity. So depending upon what handedness you are, your dominant hand can be like a centimeter larger than the other side, but really lymphedema is over 2 centimeters of, and you can kind of see, and the arm might be stiff or the arm might feel heavy.
Hmm.
Um, it's important to encourage clients who have lymphedema to wear a compression garment during class. You can get one fitted through your physical therapist or the doctor. And why is that important? It's important because when you utilize the arm, or holding uh, poses, it could cause accumulation of fluid, and that compression garment kind of tells it which way to settle back in, go back
Hmm.
within, and not linger just on the skin.
I think the lymphatic system is kind of like the Cinderella system of the body, in the sense that I think people have heard of it, but they don't really know what it is or what it does. And often it's lumped in together with another system. At least it often has been when I've taught it or learned about it. And so I think a lot of people don't realize that the lymphatic system doesn't have its own pump the way the circulatory system has the heart. And so, if anything goes awry with the system, you start to see this pooling of fluid, and we need to try to find ways to pump that fluid back toward the center of the body. So, you talked about breath as being probably the most powerful pump to get the center of the body, the pressure changing. You talked about muscle and joint movements, muscle engagement and joint movements to kind of flush that fluid back toward the heart. And then in the case of lymphedema, compression garments to help kind of create a squeeze where perhaps there isn't one going on at the moment.
Yeah, that's perfectly said.
Mm.
It's also, after you do breathing, it's really good to use those central core muscles first, and
Hmm.
then kind of go out to the extremity, and then bring back from the extremity back to the core, back to the breath.
Oh, I
So a
like that.
sequential, yeah, engaging.
Yeah.
And always think about uh, moving the fluid from the fingertips or the feet to the heart rather than outward. So you always want to bring it back towards the heart.
Same sort of strategy as dry skin brushing that I think a lot of listeners would be familiar with, just kind of guiding things gently back up toward the heart. That makes sense. I think you've given some fantastic information here, and it feels to me really doable, really achievable, that there are simple things that all of us can do to reduce our risk and also to improve the potential outcome of treatment if we are diagnosed with cancer. Things like quitting smoking, limiting drinking alcohol, limiting intake of processed foods, focusing on lots of good, vibrant plant foods to get those polyphenols, healthy fats, movement. You talked about that a lot, even if it just means sitting in a chair and moving what you can move comfortably. You talked repeatedly about the importance of breathing and getting that pump to work from the center of the body, practices that can give us a feeling of self-power and self-agency, that can improve vagal tone and heart rate variability to help us get out of that fight and flight that so many of us exist in much of the time and come back home to something that's a little calmer and quieter. And then the power of community, feeling like we have people on our team, people who are experiencing the same things that we are experiencing, feelings of connection. Have I missed anything? Anything else that you want to add to that pretty potent list?
I think that's pretty complete. I guess the only thing I might add is I think when we get a diagnosis of cancer, sometimes we kind of disassociate from ourselves. We're worried about many aspects, especially as a woman. The most common thing that women say to me is, I want to be here for my kids. And that's the one that brings about most emotion. I think yoga creates a space where you could kind of get reacquainted with yourself again, because many things have changed after a cancer diagnosis. And you're surrounded by like-minded people, just sitting and breathing or oming. I think that it's really something to treasure, because if we have that opportunity, I think it can be really powerful.
Well, thank you so much. That's been, I think, a really helpful conversation for a lot of people to listen to, and some powerful outtakes. If people are interested in you and what you do, you are definitely not going crazy on Instagram. Where would they find you?
Well, because my life is a little busy with my work and family right now, most of my writing, most of my stuff is for yoga medicine. I just wrote an article on kind of the benefits of exercise, that kind of, and it has a few like touch points. And then I also wrote an article on how to heal your body and prevention. So probably you'll find me on yoga medicine.
All right. Well, we can link to those, and I think we would all rather you focus on doing your job properly and being with your family than putting great content for us on Instagram. So thank you very much for your time, and thank you for the work that you do.
Thank you, Rachel. Thank you for having me.
Thanks for listening to Yoga Medicine. If you liked the show, be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com. Check us out on social media as Yoga Medicine, or you can email us at info@yogamedicine.com. Thank you for being part of our Yoga Medicine community.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.